Hand strength is something that we lose as we get older, as well as we can use hand strength to compensate for some of the side effects from oncology treatments. My name is Katie. I'm an oncology rehab specialist, a lymphedema specialist, and an occupational therapist. I teach hand strength to a lot of my patients, whether they've been through or are going through oncology treatments, or they're saying they are having difficulty putting on their compression garments. If you've put on compression garments, you know it takes a lot of hand strength to pull the garments on, which can affect us wearing them every day because if it's difficult and it takes a lot of time and it doesn't feel good on your hands, we're more apt to not put them on. So today I'm going to teach you a few exercises that you can do to build up your hand strength. There are lots of muscles in the hands, and so we can do different exercises to isolate or separate some muscles to really strengthen them to help you compensate from oncology treatments that may help you, that may affect you holding on to objects. It can also help you put on your compression garments easier by having more hand strength. So when somebody has gone through chemotherapy, we sometimes will get what we call chemo-induced peripheral neuropathy. That's hard to say. And so what that means is that numbness and tingling in the hands and or feet, and that can affect how you hold on to something, including your compression garments, your coffee mug, or even a pen to write your name. So hand strengthening is a way to compensate. So if you have more hand strength, you're more apt to be able to hold on to that coffee mug or pull on your compression garments. Also, as we get older, our hand strength, just like our body strength, starts to decrease. So if we do hand strengthening, we can help keep our hands strong and hopefully avoid some of the arthritis that can set in. So what I use for hand strengthening it's called Theraputty, or basically kind of silly putty. It comes in different colors, and different colors mean different strengths. Yellow is typically the lightest, but you'd want to check on whatever strengthening putty that you choose to buy. I will link what I suggest buying from good old Amazon, and it comes in different levels. Sometimes it takes a little bit to kind of warm up. So when I first get it out of the container or teaching my patients, I said just kind of warm it up in your hand, kind of move it back and forth. One, it's a great way to get your hands warmed up. Two, it'll warm up the putty so it's not so strong. So the first exercise is just to make a ball with your hand or with your hand putty and then make it a little bit longer, because what we're wanting to do is to put it in the palm of your hand and curl your fingers down, your four fingers. I want all four fingers in the putty, and then what you're going to do is you're going to curl those four fingers. We're looking at a curl at this knuckle, and this knuckle, and we're squeezing the putty until no more putty comes out. And once that happens, then you can stop. You rebuild your ball or long ball shape to make all four fingers fit and squeeze nice and tight. So with hand putty, it is something that you can do too much of. Any strengthening, we really want to be careful to not overdo it. So one time a day, maybe do one set of 10, probably start off at one set of 5 and build up to that one set of 10, just to kind of get your body warmed up to it. We don't want to overdo this because then you can get tendonitis and have some hand pain, and we don't want that. So that's the first exercise. The second exercise, again, same shape, kind of a long oval, if you will, and you're going to place it in your hand, and you want it a little bit higher than your index finger. You're going to place your thumb right on top, and you're going to push that thumb tip through, and you're going to go all the way down to the putty until you cannot bend anymore. Perfect. So what that does is now we're strengthening the thumb. The thumb tends to get the most arthritis in women, so we really want to make sure we're strengthening the thumb. Also, the thumb helps you grab those compression garments. So that kind of grabbing motion, you really want to strengthen the thumb. So again, a long shape, put it in your hand, put your thumb on top, and you're going to tip the thumb right on in the putty and keep going until you cannot go any further. So again, I like to start at the yellow putty, one set of 5, try to build up to one set of 10. Two hands, you're going to do both sides. So it takes a little bit of time. And so a lot of times, I try to incorporate our exercises into just everyday activities. But you could do this while you watch TV. However, just be careful that you're not doing it for too long. You really got to count, because it would be easy to sit there for a whole episode, 30 minutes, and be playing with this putty and your hands start to ache. So be careful with that. The last one that I'm going to teach you is you're going to make a ball, and then you're going to make a small donut hole. So nice and small. You're going to push all 5 tips through, and then you're going to open up the putty by opening up your hand as wide as you can. And really, I want you to open up as wide as you can. A lot of times in our functional activities, we're not opening our hands super wide. We're kind of keeping them close in, especially as we type. We don't get a lot of movement when we're spreading out the hand. So this is important, because it's not something that we do a lot in our day-to-day stuff. So small donut hole, push all 5 fingers through, and open it up as wide as you can. So a couple of things about the putty. One, it's super fun to play with. Don't overdo it. Number 2, they all come in little containers. When it's not in your hand, it has to go in the container with the lid on. What happens is it starts to create a little mind of its own, and it can start to goop out. It'll stain carpet, clothing. Be careful with kids getting a hold of this. I know my kiddos like to play with it, which is great. However, it has to go back in the container, or you will not be happy with me or your kids or yourself if you come back to it staining carpet in your clothing. So if it's not in your hand, put it in the bucket. One time a day would be just great, even every other day. It doesn't have to be an everyday thing like strengthening. You could do it every other day. You could say, my goal is 3 times a week. Put it in a place where it's easy to get a hold of, such as, next to your chair that you like to watch TV in. You could do it in the car. Be careful with the heat, because it can melt. So I guess if it's a little bit cooler where you are, then you could do it in the car. Just make sure, again, it goes back in the container with the lid on tight. The goal is 1 set of 10 to get to, but start at 1 set of 5. Start slow, slowly build up to it. And if you're feeling any kind of achiness or pain with it, back off. 1 set of 4, 1 set of 3. Listen to your body and slowly build up your strength.